before the virus can even be managed. Individuals, especially those who exercise risky behavior.
The Education Ministry has recently reported a concerning increase in HIV infections among young people in Malaysia.
Lebih 60% kes jangkitan HIV tahun lalu berpunca daripada hubungan homoseksual dan biseksual.
Terdapat trend peningkatan yang membimbangkan kes jangkitan HIV dalam kalangan pelajar pengajian tinggi IPT.
Menteri Kesihatan Datuk Seri Dr. Zulkifli Ahmad mendedahkan data menunjukkan 96% jangkitan HIV di Malaysia pada lalu berlaku melalui hubungan seksual.
Masa depannya yang disifatkan sudah musnah dan hancur bertambah gelap dan suram selepas dia disahkan mengidap HIV.
Assalamualaikum and a very good morning to my beloved lecturer, Madam Nur Syahidah binti Zulkifli and my fellow friends. Today, my group and I will be presenting on the topic of how the Ministry of Health managed the issue of HIV and AIDS. Before we go deeper into this issue, let me and my group members introduce ourselves first. Starting with me, my name is Nurhanis Afifah binti Karim and I will be the presenter for the introduction and also conclusion for this topic. Next with me today are...
My name is Nur Aina Nasuha binti Arifin.
Hi everyone, my name is Takif bin Abdul Aziz.
Hello, my name is Nurin Suraya binti Sadun.
Hi, my name is Nur Zahra binti Ismail.
Hi, my name is Nurnia Inshira binti Ismail.
Okay, now let's move on to the introduction. The Ministry of Health Malaysia is one of the most important ministries in the country and is responsible for maintaining the health of the population. This includes managing major public health challenges. Malaysia's healthcare system began after independence in 1957, while MOH itself was established in 1955. Since then, its functions have expanded in response to public health needs and advancement in medical technology. MOH provides high-quality medical treatment and ensures equitable access to healthcare facilities. It also offers accurate and reliable health information which plays an important role in preventing the spread of infectious disease. The core values and vision of MOH focus on empowering the public to value their health and improving the overall well-being of the population. Next, MOH currently operates under the leadership of the Ministry of Health, Datuk Seri Dr. Zulkifli Ahmad. The vision of MOH is to unite national efforts toward better health, while its mission is to lead and collaborate in enabling access to quality healthcare service. MOH also manages several important health programs under the lead by the Director General of Health and under the lead of Secretary General. Okay, now let's move on to the issue in Malaysia. Currently, Malaysia is facing rising number of HIV infections among students in higher learning institutions. Most HIV cases are caused by IPT students, which 222 cases identified, including those aged 18 to 19. Based on MOH statistics, 191 HIV cases recorded among IPT students between 2020 to 2024. Therefore, Malaysian AIDS Council MSC plays an important role to prevent these issues by distribution of HIV self-testing kits to improve early detection and reduce stigma. The effectiveness of MOH and MSC can be seen through international achievements. One significant milestone is the WHO recognition for the elimination of mother-to-child transmission of HIV and syphilis in October 2018 and made Malaysia the first country in the Western Pacific region to achieve this recognition. The key strategies implemented by MOH and MSC include strengthening public health surveillance to monitor HIV cases more effectively. They also expand access to HIV treatment and healthcare services, ensuring that individuals living with HIV can receive early diagnosis and continuous treatment. As a result of these strategies, Malaysia has experienced a reduction in HIV transmission rates and continuous support for affected communities. In conclusion, the Ministry of Health Malaysia plays a crucial role in managing the issue of HIV and AIDS through comprehensive healthcare service, prevention programs, and strong collaboration with the Malaysian AIDS Council.
Today, I want to explain about the planning by the Ministry of Health Malaysia in managing HIV/AIDS. First, MOH implements the National Strategic Plan for Ending AIDS or NSPA 2016 to 2013, which is a long-term plan to end AIDS by the year 2013. This plan is based on the UNAIDS 95 to 95 to 95 targets, focusing on testing, treatment, and viral suppression. Next, MOH expands HIV screening and treatment through decentralization. This means HIV services are provided at primary healthcare centers, allowing yearly detection through routine screening and testing for high-risk groups. MOH also strengthens prevention programs, such as the needle syringe exchange program methadone maintenance therapy, and condom distribution programs to reduce HIV transmission. In addition, multi-sectoral collaboration plays an important role. MOH works together with agencies like NADA, MOE, JAKIM, and the Prison Department, as well as NGOs such as MAC and MAF, and the private sector. For the short-term focus, MOH aims to increase HIV testing among young adults, improve public awareness, reduce stigma, and expand access to ART and PrEP. Last, the long-term focus is to achieve zero new infections, zero discrimination, sustainable treatment, viral suppression, and a strong healthcare system.
Alright, now I'll explain how MOH organize HIV issues in Malaysia. First of all, MOH use a decentralized approach where HIV services are provided through klinik kesihatan, not only major hospital. This improves access to the treatment and helps reduce stigma for people living with HIV. MOH also works with the Malaysian AIDS Council and NGO to deliver outreach and harm reduction programs, ensuring services reach the community. Next, organizational capacity and physical asset. At the organizational level, MOH manage policy, surveillance and drug supply centrally, with a clear structure from national to district level. Policies are centralized, but services are delivered locally using standard guidelines. MOH has a nationwide network of public hospital and klinik kesihatan covering both urban and rural areas. Alright, next, human and financial resources. In human resources, there is a clear role specialization, which is doctor and nurse provide treatment, counselors support ART adherence, and community health worker focus on prevention. More than 15,000 patients receive ART nationwide, while in 2024, HIV spending is about 93 million ringgit, mainly from domestic funding. Alright, next, MOH objective. In the short terms, MOH focus on strengthening healthcare services, while in the long term, MOH aims to improve coordination, reduce service gaps, and ensure sustainable HIV care in Malaysia.
Let's move on to the next point, decision making. What is decision making? So, decision making is a process of identifying and selecting a course of an action or an alternative to solve a specific problem. The public manager evaluates the alternative and makes a summary for the list of alternatives. The decisions were made to ensure the goals can be achieved. There are two types of decision making. The first one is program. The program are related to the routine and repetitive problems, typically made at lower management levels. The other one is non-program. Non-program decisions tackle unique or unusual problems that demand a high level of executive judgment and consideration. These decisions are usually made by a higher level managers.
Next is controlling. How to control or prevent from HIV or AIDS. Controlling HIV includes health programs, prevention strategies, regular medical care, and adherence to antiretroviral therapy for those who are living with the virus. Here, we present ways to prevent HIV in general first. For prevention methods include needle exchange program (NEPs) for people who inject drugs. Use needle exchange programs or safe injection programs that can provide access to clean syringes. These programs also help to reduce the spread of infectious disease like HIV and hepatitis. Next is post-exposure prophylaxis (PEP). If you believe you have been exposed to HIV, start taking PEP within 72 hours can help prevent infection. This is a short-term treatment that must be taken for 28 days. People non-infected with HIV also could take PrEP and PEP to prevent it. And here is how Ministry of Health MOH preventing HIV or AIDS. First of all, MOH Health HIV PrEP program. For example, a student health clinic may offer a PrEP program where students can get tested for HIV, especially for those who are at a high risk of HIV. Taking PrEP can reduce the chances of contracting the virus. When taken as prescribed, PrEP can lower the risk of getting HIV by 99% when taken correctly. Moreover, MOH also help ProStar 2.0. This program is to educate young people about HIV and sexually transmitted infections (STIs). This program also aims to reduce stigma and discrimination related to HIV or AIDS by promoting understanding, acceptance, and positive attitudes among young generation. Other than that, we also need to know how to manage HIV for those infected. First of all, you need to take a regular medical care. For example, at public health clinic, you will get tested for HIV prior to PrEP initiation and will proceed to the other procedures. Regular checkups with a healthcare provider are important for monitoring viral load and CD4 cell counts, which indicate immune system health. Last but not least, antiretroviral therapy allows individuals with HIV to live long, healthy life.
SWOT analysis planning. For planning, we use a SWOT analysis to understand the current HIV/AIDS strategy in Malaysia. In terms of strengths, Malaysia has a clear national framework through the National Strategic Plan for Ending AIDS from 2016 to 2030. There is also strong government leadership with good coordination by the Ministry of Health. In addition, evidence-based prevention programs such as needle exchange, methadone in maintenance therapy, and antiretroviral treatment are already in place. For weaknesses, stigma and discrimination towards people living with HIV still exist. Awareness among young adults is limited and access to services is not equal in all areas, especially in rural locations. Looking at opportunities, there is strong support from NGOs and community-based organizations. Advances in HIV treatment and prevention, such as PrEP and ART, also improve outcomes. Malaysia also benefits from international guidelines and support from organizations like UNAIDS and the CDC. Lastly, the main threats include social stigma that discourage people from testing and seeking treatment. High-risk behaviors among youth and key populations remain a challenge, along with long-term financial and resource sustainability. Overall, this SWOT analysis help guide better planning for HIV/AIDS management. For organizing, the strengths include easier local access to HIV services, as care has been moved to local clinics. This helps reduce stigma and makes it easier for people to seek treatment. In addition, specialized doctors, counselors, and community workers have clear roles which improves the quality of care and treatment adherence. However, there are weaknesses such as service gaps and fragmentation, where services are not always well connected. Coordination between the public and private healthcare sectors also need improvement. In terms of opportunities, strengthening primary healthcare allows better integration of HIV services. Targeted funding also supports more effective outreach to key populations. Lastly, the threats include persistent stigma and the challenge of sustaining long-term organizational reforms. Overall, strong organization is essential to ensure effective and continuous HIV care. For decision-making, the strengths include almost free access to antiretroviral treatment, including first, second, and third-line therapy, which ensures treatment continuity for people living with HIV. The use of programmed decision-making also helps improve efficiency and consistency in treatment decisions. However, there are weaknesses such as heavy dependence on government funding and limited human resources, which increase workload pressure on healthcare professionals. In terms of opportunities, new policy formulation allows better adaptation to emerging HIV trends. Advances in medical technology improve testing accuracy and treatment outcomes, while increasing public awareness and help reduce stigma and encourage early testing. Finally, the threats include economic challenges like inflation that may affect funding sustainability, as well as the emergence of drug-resistant HIV. Overall, effective decision-making is crucial to ensure sustainable and high-quality HIV care. For controlling, the strengths include the continuous efforts by the Ministry of Health since the implementation of the National Strategic Plan for Ending AIDS in 2016. Programs such as needle exchange and PrEP also provide important entry points for HIV testing, counseling, and ongoing care. However, there are weaknesses as some individuals only seek treatment when HIV has already progressed to AIDS. Risky sexual behaviors or needle sharing also continue to contribute to new infections. In terms of opportunity, Malaysia has the potential to reduce new HIV infections and move closer to the global goal of ending AIDS as a public health threat by 2030. Education programs can also help normalize discussions about HIV prevention and reduce misinformation. Finally, the threats include the criminalization of drug use and same-sex relationships, which may discourage people from accessing services. This can also limit acceptance of sexual health education, PrEP use, and harm reduction programs. Overall, effective controlling is essential to monitor progress and strengthen HIV prevention and care. Based on the SWOT analysis, several recommendations can be proposed. For planning, the Ministry of Health and the Malaysian AIDS Council can conduct anti-stigma campaigns in schools, universities, and local communities. Sharing experiences and testimonials from people living with HIV can also help reduce stigma. In addition, access to HIV services in rural and remote areas can be expanded through mobile clinics and collaboration with local communities. In terms of organizing, MAC can develop a more integrated healthcare system to strengthen HIV services from screening to treatment in a structured and systematic way. Strong collaboration with the private sector through data sharing, training, and inclusive guidelines is also important to ensure non-discriminatory care for people living with HIV. For decision making, funding sources should be expanded by encouraging support from NGOs, the corporate sector, and international partners to improve financial sustainability. The MOH and MAC can also recruit more healthcare professionals, especially those with expertise in HIV management. Lastly, for controlling, early HIV screening programs should be strengthened in government clinics, schools, and youth centers to enable early detection and prompt treatment. Behavior change programs should also be implemented to reduce unsafe sexual practices and needle sharing. Overall, these recommendations aim to strengthen HIV prevention, treatment, and long-term sustainability in Malaysia.
Next, for the recommendations related to trade, they can be explained through the four management functions, which are planning, organizing, decision-making, and controlling. Firstly, in terms of planning, the Ministry of Health MOH and the Malaysian AIDS Council MAC should plan continuous public awareness campaigns to reduce stigma towards HIV and AIDS. These campaigns can be implemented through social media, webinars, and community-based programs. In addition, financial planning should be strengthened by exploring alternative funding sources such as collaborations with NGOs, the private sector, and corporate social responsibility initiatives. Next, from the organizing aspect, MOH and MAC can expand the network of community clinics and provide support programs to ensure that people living with HIV feel safe and accepted. Continuous training for healthcare personnel is also important to ensure that organizational systems operate effectively. For decision making, MOH management should demonstrate strong leadership by promoting non-discriminatory attitudes and supporting the implementation of HIV and AIDS related policies. Lastly, in terms of controlling, regular monitoring and evaluation should be conducted to ensure that all implemented programs achieve their objective and can be improved when necessary. In conclusion, a systematic management approach can help MOH reduce threats and manage HIV and AIDS issues more effectively. And with that, we have come to the end of our presentation. That's all from us. Thank you, everyone.